Hello and welcome to this special podcast specifically designed for the Year 3 students at Imperial. Today we're going to be talking about the arthritis. Now this topic is often made quite difficult throughout the study in medicine, however it is actually a very simple subject. The arthritis are basically diseases that cause inflammation of joints, and the best way to divide them up is into those that are inflammatory and those that are non-inflammatory. The inflammatory conditions can be further subdivided into those that are acute and those that are chronic. But we're going to talk about the non-inflammatory condition first of all, and the one that needs to be known about is osteoarthritis. Now, osteoarthritis is a condition where the articular cartilage is lost over time, and it tends to affect the joints that are load-bearing, so for example the knees, the hips, the spine, and in particular the distal interphalangeal joints of the hands. So the joints are generally quite large, although they can sometimes affect the small joints. It is something that occurs with increasing age and appears to have some kind of mechanical component, as patients who have injured previous joints in the past often get osteoarthritis in those particular joints. Now, there are a few characteristics that differentiate it from the other arthritides, one of which is the characteristic of morning stiffness. Classically, the patients with osteoarthritis get morning stiffness, which lasts for less than an hour. So as they wake up, they appear very stiff. Once they start to move around, the joints will effectively loosen and the stiffness will disappear. Another characteristic is shown in the picture in the bottom right, and that is the extra formation of bone around the joint. These are called osteophytes, and in the distal interphalangeal joint you can get Heberden's nodes, which are these bony outgrowths that appear in the distal interphalangeal joint. So that's osteoarthritis, and the main characteristics are that it affects the larger joints, such as the knees and the hips. You get extra bone formation called Heberden's nodes, get loss of articular cartilage, and there's an increasing incidence with increasing age. Now we're going to talk about the inflammatory arthritides, which, as I said earlier, were classified into acute and chronic, with the chronic conditions lasting months or even years, whereas the acute generally occur within a couple of hours and last for a couple of days. We're going to talk about the chronic arthritides first of all, as these are much more common. And these are further subdivided dependent on whether the patient has a particular antibody within their blood. And this antibody is called rheumatoid factor, which is a IgM antibody specific to IgG. And therefore the patients can be divided into those which are seropositive, which the main condition is rheumatoid arthritis, and those patients who are seronegative, in which case they don't contain rheumatoid factor, and these are numerous, and we'll discuss these later. But we'll focus on the seropositive arthritis, which is rheumatoid arthritis. Now, rheumatoid arthritis is a chronic symmetrical inflammation of the joints, and it is very prolific within the population, and it classically affects the hands and the wrists of the patient. So it's all the small joints. And it's symmetrical, so very rarely will only one hand be involved. It's usually both hands. However, other joints can also be involved, such as the elbows, the shoulders, the knees, the ankles, and the small joints of the feet. Now, rheumatoid arthritis is an extremely debilitating condition, and it has three characteristic features, particularly within the hands. And this is shown in the bottom right-hand picture. So first of all, we can get a deformity called Boutonier's deformity, which is shown here on the thumb. And this is very similar to when a finger presses down on a button, hence the name Boutonier's. We can also get the ulnar deviation at the metacarpophalangeal joint, so all the fingers will be deviated to the ulnar side of the hand. And finally, we can also get something called swan neck deformities, which is where we start to get subluxation of the proximal or distal interphalangeal joints. And as can be shown by this picture, rheumatoid arthritis is an extremely debilitating condition. The other characteristics that are found with rheumatoid arthritis is that compared to osteoarthritis, the morning stiffness generally lasts for more than an hour. And if you think about this, because rheumatoid arthritis is an inflammatory condition, it's ongoing throughout the day, and therefore movement will not relieve the symptoms of rheumatoid arthritis. Hence, the stiffness lasts for more than an hour. And finally, as I mentioned before, about 70% of patients who have rheumatoid arthritis will be positive for rheumatoid factor. However, it is not an exclusive test and is not diagnostic neither. However, there are new tests that are coming through, and one of which is called CCP. And if CCP is positive, it has a much higher predictive value for a patient having rheumatoid arthritis. So that is the seropositive arthritis. Now we're going to talk about the seronegative arthritis. And these can be remembered through a rather rude mnemonic, which is CRAP, or CRAP. And they each stand for one of the seronegative conditions. So C stands for the colonic arthritis. That was its old name. It's now called enteropathic arthritis. And this is found with association with inflammatory bowel disease, in particular Crohn's disease. So these patients will have an ongoing history of Crohn's and then will start to develop arthritis along with that. The second one, R, stands for the reactive arthritis. And this is an arthritis that generally occurs after an infection, usually a genital infection, although sometimes it can be an infection which is to do with the upper respiratory tract. So classically, this is a young gentleman who presents with ulceration on their genitalia, and then a number of days or weeks later will start to get an arthritis within one of their joints, usually the knee. It's thought that this arthritis is due to some form of molecular mimicry, or if the immune system goes awry. The last two, so A stands for ankylosing spondylitis, and P stands for psoriatic arthritis, and we'll cover these in a bit more detail. So A is ankylosing spondylitis, and this is one of the rare arthritis that actually affect men more than women. And it's strongly associated with the HLA gene HLA-B27, with over 95% of patients who have ankylosing spondylitis also having HLA-B27. Now, ankylosing spondylitis classically affects the spine and the sacroiliac joints. And it starts with an inflammation in these areas, and then we start to get fusion of the joint spaces. And in the vertebral bodies, as shown here in the bottom right, you'll actually start to get extra articular bony growths, which will actually cause the bones to fuse together. And this will cause stiffness in the back in the early morning, which will also improve with exercise. And clinically, an indicator towards ankylosing spondylitis is made through the Schober's test. Here we mark 2 points on the patient's back, one 10 centimeters above the dimples of Venus and one 5 centimeters below the dimples of Venus. We then ask the patient to bend over to touch their toes, and in a normal patient, the difference between the 2 points will increase by more than 5 centimeters. If it doesn't increase by more than 5 centimeters, it indicates that the patient may have ankylosing spondylitis. The last seronegative arthritis is called psoriatic arthritis, and this is an inflammatory arthritis that occurs in association with the dermatological problem of psoriasis. And there are 5 major forms of psoriatic arthritis, and luckily 3 of them mimic the other arthritis. So the first one is polyarthritic, which is very similar to rheumatoid arthritis in that it affects the small joints of the hands, the elbows, and the shoulders, and often it is symmetrical. The second one mimics ankylosing spondylitis in that it affects mainly the axial joints, so the joints of the vertebra and the sacroiliac joints. The third one is one that is similar to osteoarthritis in that it involves the distal interphalangeal joints only. And then we have the asymmetric type. This is the one that's most often found in psoriatic arthritis, and it involves a huge number of different types of joints and is very asymmetric in its appearance. So sometimes it can involve one knee, one shoulder, a couple joints in the hands. So it's a very difficult one to diagnose. And then the final one is arthritis mutilans, which is an extremely destructive form of psoriatic arthritis. In this condition, the bones will actually start to erode, leaving only the soft tissue around it. And this is shown in the bottom right, and as you can tell, it's an extremely debilitating condition, and it actually progresses very rapidly. So we've covered the chronic inflammatory arthritis, and now we're going to go briefly over the acute inflammatory conditions. And these are split into two major types, the septic and the crystal arthropathies. So the septic arthritis, by its name, is generally involved with infection. So the most common culprit is Staph aureus. However, streptococci and other bacteria can also be involved. And what happens in this is that the bacteria will invade a particular joint, often the knee. So this can be after a surgical procedure, or it can be due to a cut in the skin, which will lead to infiltration into the joint space. Now, this is actually a medical/surgical emergency, because if the bacteria are left in the joint for a prolonged period of time, it can lead to rapid destruction of that joint. And therefore, they need to be treated very quickly with either IV antibiotics, which will penetrate into the joint space, or with a washout of the joint. The last two are called the crystal arthropathies, and it encompasses gout and pseudogout. Now, the main characteristic of both of these conditions is that they are probably the most painful arthritis possible. But they do share some characteristics, but there are a few major differences which we'll talk about now. So gout and pseudogout are the crystal arthropathies. As I said earlier, they are extremely painful, and classically they affect the first metatarsal phalangeal joint. And there's a very famous picture where there appears to be a kind of beast biting into the first metatarsal joint. So this gave the name of gout, it used to be devil's grip, because of its pain. Now, gout and pseudogout are due to the deposition of previously soluble substances into the joint space. So uric acid and calcium pyrophosphate are normally soluble in the blood, but due to either an increased production or a decreased excretion, crystals of these products will form within the joint spaces, which will lead to inflammation and become very painful. In gout, it's uric acid that causes its symptoms, whereas in pseudogout, it's due to calcium pyrophosphate. Now, the way that we are able to diagnose whether it is gout or pseudogout is by taking an aspirate of the joint and then putting the aspirate through a plain polarized light. Now, the crystals of uric acid are negatively birefringent, whereas the crystals of calcium pyrophosphate are positively birefringent. And that is how we are able to diagnose which one it is, and therefore use the correct treatment. However, both treatments will use copious amounts of analgesia. Now, we've talked about the arthritis, and we've talked about the main characteristics. One of the easiest ways of actually deciding which type of arthritis it is by drawing this form of table, in which we decide whether the joints affected have a symmetrical presentation. We decide the number of joints that are involved, so whether it's monoarthritic, pauciarthritic, or polyarthritic, and finally, which type of joints are involved, so whether it's the small joints, the large joints, or the axial joints. So as you can see, rheumatoid arthritis is symmetrical and generally affects the small joints. Osteoarthritis can affect any number of joints and usually affects the large joints, although it can affect the distal interphalangeal joints, which makes the small joints. Ankylosing spondylitis affects the axial joints. Psoriatic arthritis is able to affect every joint and have every type of presentation, if you remember the 5 major forms of psoriatic arthritis. And finally, gout generally affects a single joint, although it can affect a few different joints, and the actual type of joint is usually the small ones, although sometimes it can present in the knee especially. This concludes the arthritis Podmedics podcast. And just to summarize, the arthritis can be divided into the inflammatory and the non-inflammatory arthritis. And the inflammatory ones can be further subdivided into the chronic, which are divided into the seropositive and seronegative arthritis, and the acute, which include the septic arthritis and the crystal arthropathies. Thank you very much for listening, and I hope that you've been able to take something away.